Hi, this is Sandhaya and I'm doing Shigellosis. Shigellosis is a gastrointestinal infection that is caused by the Shigella bacteria. There are 4 species of Shigella bacteria that can cause these conditions. All are gram-negative, non-spore, facultative anaerobe, non-sporing forming, and they're either spread through fecal or oral route, contaminated food, water, person-to-person contact. It's also most common in daycares, crowded living spaces. And the structural is that it's very similar to Salmonella species, Vibrio cholerae, and Campylobacteria jejuni. The micropathologies is that it's powered by its non-motile form, which enables it for internal infection, and it's unique for the plasmid and toxin genes, which lets it invade and kill the colonical epithelium. And you can distinguish between the Shigella versus other species that are very similar through either routine microscope testing analysis and biochemical testings. Signs and symptoms is very severe. It's mostly an acute diarrhea that can be formed watery or bloody diarrhea. As the disease progresses, you can have fever, low blood pressure, and dehydration. That's very common. And then after shigellosis, you can have reactive arthritis, which occurs within 2 to 4 weeks after the infection has sustained, and then it's associated with HLA B27, which is most common in young males. And then the structural tissues the cell disease infect is mostly the colon. Of course, it affects your internal organs, mostly the colon, and it targets the colonic epithelial cells, especially M cells and enterocytes. After entering through the M cells, Shigella basically invades the lamina propria and it spreads laterally, cell to cell. This, of course, this invades and it destroys the epithelial barrier, leading to ulcerations, inflammations, mucus, and bloody diarrhea. The pathologies and disease progressions is that the ability of Shigella to produce disease relies on its essential elements that enables invasion and toxicity. Invasion factors include Shigella secretes virulence factor that allowed it to infiltrate and colonize the colon epithelium. Toxins are Shigella toxin, the main virulence factor produced, and enterotoxins, which are basically contribute to the result of the watery or bloody diarrhea and general symptoms like fever. And of course, this organism causes illness by invading. It invades the colon lining, triggering an intense inflammatory response, which then causes ulcer and colon mucosa. This damages the small volume stools containing pus and erythrocytes, and then you have like systematic effects such as the Shiga toxin can cause severe and systematic illness. And then from the beginning to the end, you have exposure when you have transmissions occurring either through direct or fecal route, or through crowded spaces. And then you have invasion, which, lasts for about 1 to 4 days. And then the symptoms onset, which, of course, is bloody, it's painful, it's unbearable. And then resolutions, because it's a self-limiting disease, it kind of resolves within 5 to 7 days. And then treatment options include such as stool culture. You can do PCR testing or blood testing to just understand how can this be detected from other specimens. And then, like stated before, treatment options is that it's self-limiting infection, so it kind of goes away by itself after a certain amount of time. You don't need no vaccine. Right now, there is no licensed vaccine. And then there's antibiotic therapy afterwards, like fluoroquinol, azithromycin, often when resistant is suspected. And then third generation cystifluorine for high-risk patients such as old, young patients, or HIV/AIDS patients, and patients who have traveled recently to third world countries. And once the cultures and sensitives have come back, we can narrow down the antibiotics to what the bacteria is susceptible to. And then, of course, what you can do at home is just hydration, electrolytes, and just anti-fever medications, clear liquids, followed by a low-fiber and lactose-free diet, because we don't want to upset anything, and then nutritional supplements, especially in malnourished children. Thank you.